So I'm Margaret Firerobin. I'm board president of Bristol's Promise, that originally was Bristol's Promise. Actually, it was Youth Networking Alliance originally, and then Bristol's Promise Youth Networking Alliance. And Melissa Roberts may elaborate a little bit more later, but we are working hard on changing our name to Appalachian Promise Alliance. So as a lot of y'all know, that's a big job when you change your name and your branding, et cetera. So that will be a process. So I want to welcome everybody. It's exciting to be together. And we continue to appreciate the Zoom option. We met together in person in September for the first time in 2.5 years. We're back to virtual. One, it's a lot easier for folks, and the other is if everybody here is like my life with Bristol's Promise, with Family Promise of Bristol, there are people who are sick just everywhere. And the biggies are COVID, flu, and RSV, but there's, you name it, people have it. So this way we keep our germs to ourselves and are able to keep going or join if we don't feel well. We can still be here. So, and today we're particularly excited to have an update on Ballad's Population Health Initiative. And we're also real proud that Youth Networking Alliance, that we brought folks together to hear about it initially in 2017. And that was with Tony Keck, who's still with Ballad Health, Exec Vice President for System Innovation and Chief Population Health Officer. And then the year later, we had Trod Norris, who's now serving as Senior Vice President of Community and System Advancement, who gave us an update. And at that point, the merger was new, and the COPA, the agreement was part of that, was population health, to improve the health overall, not just treat people who are ill. So it was exciting to learn about it at that time, and I don't know why we've waited so long, but we've waited a little while to get an update. So we're pleased to be able to do that. And Melissa's going to introduce Rachel Stiltner in a few minutes about that. So wanted to also recognize Bristol's Promise or Appalachian Promise Alliance folks on our board. Kay Ward, Lynn Pinnell are here. Those are the folks I see right now. If I miss somebody, I'll try to catch them later. And our Youth Networking Alliance, part of our organization, meets every other month. January, March, May, we skip July. September is our kind of our State of the Schools meeting. And then we combine now with Trauma Informed Care Network for December. And it's usually not the fourth Thursday, which is Thanksgiving. So it ends up to be the first Thursday in December, which also happens to be the Christmas parade in Bristol. So hopefully some of y'all are going to be joining that. I wanted just to do our usual. We recognize the 5 promises of America's Promise. That's where our name originally came from. And we became a community of promise at the beginning. But those promises build resilience in our children and youth, and we know that they also apply to our families and individuals as well. And they have continued to weather the time. They were appropriate in 2005 when we embraced them, and they're more just as appropriate today. And those are ongoing relationships with caring, responsible adults, a healthy start and future, safe places and structured activities during non-school hours, effective education for marketable skills, and opportunities to help others and to give back. So we like embracing those. We feel like that fits so well with resilience that we're focused on with our accountable care community, strong ACC, and a lot of the work that we're doing. So with that, I will introduce Melissa Roberts. She'll introduce staff who are not sick and able to be here today. And then she'll introduce Rachel, that we're thrilled to have participating.
Thank you, Margaret. I appreciate it. And yes, I am going to introduce staff that are not on vacation as well, because it's that time of year. Everybody's kind of trying to take some vacation time before they lose it. But Susan Turner is with us, and you all may or may not have met her. She is one of our newer staff members. She is our PACES, Positive and Adverse Childhood Experiences Program Coordinator. So she is going to be overseeing the Trauma Responsive Care Network for Northeast Tennessee, coordinated with Southwest Virginia, and doing some really awesome work aligned with a lot of you all that are on this call already. So she's here with us today. Everybody else, unfortunately, is either working on site or sick or taking vacation. So it is my absolute honor to introduce Rachel Stiltner, whom I've gotten to know over the past several years and consider her a friend. She's the Senior Community Engagement Specialist with Ballad Health's Department of Population Health, and she leads a team that translates objectives related to the social determinants of health into community engagement and programmatic initiatives. She and the population health team manage the Community Health Improvement Site funds, which tracks the goals and objectives and outcomes for over 30 partners, and also a host of internal resources that you'll hear about from her today. And as she is talking with us today, you'll notice she is an amazing storyteller, partially because, or maybe that's why, she was previously the Director of Communication and Outreach for the International Storytelling Festival, where she oversaw a slew of projects, including Shiro's Journey, Young Appalachian Story Summit, Freedom Stories, Kids Storytelling Institute, so many more. I could go on about Rachel for a long time, but we would take up the whole thing. So I am going to go ahead and share my screen. And Rachel, if you'll just kind of let me know when you want to move ahead, we can do that.
I can do it. Thank you, Melissa. I appreciate the warm introduction there, and I hope everybody's doing okay. I know it's that time of year where we're all partially checked out anyway, so just I'm going to try to make this as engaging, as informative as I can. So if I can see you on camera, just go ahead and wiggle your ears if you're with me. Anybody? No? Okay. Well, thank you again for having me, and thank you to Bristol's Promise and the Youth Networking Alliance for all the work that you're doing. I always refer to Bristol's Promise as sort of the OG of all things collective impact. And so we've had a lot to learn from each other in the past couple of years, and just really excited to keep growing this work. So we are the Department of we are the Department of Population Health. And a lot of what the leg of our non-clinical side does is work on community health improvement. So Melissa, you can go ahead and move us forward there. Awesome. So today we're just going to do some overview. Margaret did a great job of kind of saying where we've been. I'll go over a little bit more of that context, but also give you an update of where we're at, where we're going, and how we hope to get there. So I'll look forward to sharing that with you all. And I want to go ahead and preface this ahead of time. As told everybody else earlier, I'm having to operate off my Wi-Fi. So if for some reason we get interrupted, please know I'll jump back on, and Melissa can pick up the start steering the ship in my absence. But I'm struggling. So if somebody wants to get on the phone with Bright Ridge for me, I'll be happy to give you that job. But we'll go ahead and get started and give you some context about where we've been. You can go ahead and move forward, Melissa. Awesome. So we are celebrating, as Margaret mentioned, 4 years post-merger. So back in 2018, there was a large merger that included at that time 29 counties and 21 hospitals. So since the merger, of course, we had, a worldwide pandemic, which has sort of, interrupted in a lot of ways some of the community health initiatives, because so much of our priority, all of our priority, had to really go into the pandemic. But at the same time, I think that there's a lot of ways in which that's actually ended up strengthening our work. I think it gave us some time to sort of, do some reorganization as a department, and also to figure out and focus our goals and our efforts and energy. So we are into the merger, and I hope we get to a point where, my goal is that we start talking about, Ballad moving forward as an entity outside of the merger. And so I'm really excited to just keep strengthening the relationship with the community so that we can do that. You can go ahead and move forward, Melissa. All right. So Margaret did mention that COPA NCA. COPA, if you're not familiar, stands for Certificate of Public Advantage, or on the Virginia side, that's called a cooperative agreement. And so because the merger was historically large, Ballad was engaged in making some enforceable commitments to our community partners. That includes this very large investment of $308 million. And in that $308 million, what we want to do is try to improve our population health, expand access to care, and support health research and medical education. So what I'd like to do is kind of give you a breakdown of our work in terms of those investments. So Melissa, if you'll move us forward. All right, so you can see here, this kind of outlines some of the breakdown of our investments. You know, in terms of conduct, these are many things on the clinical side, like for example, you know, making sure price increases are capped, that we're sharing the market with other folks like our friends over at, you know, State of Franklin, you know, Stone Mountain over on the Virginia side. So keeping the market open and sharing that is things that we're held accountable for. So you'll look in this middle column and you'll see all of our investment dollars. And so that's really what is driving a lot of our work. I've highlighted what is our realm of work right here, which is this population health piece. But, you know, you'll take a look here and see that we're also making an investment of $85 million over those 10 years in behavioral health, $85 million towards academic and research. Of course, you've got the Population Health Fund of $75 million. $28 million is going to rural health services. $27 million is being funded directly to children's services. That's via Nice-Monger Children's Hospital. And then $8 million into the health information exchange. You know, and ultimately, what we're all accountable for across the board here is improving the population health, preserving access to care, and improving overall quality. So those are those are our guiding principles. Okay, so this kind of breaks down where we are in terms of, I like to note it as sort of programs, partners, and then our plans and where we are right now. So for those of you who don't know, these are all programs that are managed internally by the Department of Population Health. So I'm going to give you some brief overview there. And then if you have deeper questions about some of these programs, I would prefer to just connect you with the people that lead them if you're looking for more information. But the Appalachian Highlands Care Network is an organization that is meant to help our most vulnerable populations access health care. And so that's for our folks in the region that are falling 225% below the poverty line. And we know that it's really difficult, you know, not just to get primary care, but, you know, what happens when those folks need specialty care? Things become a lot more complex. And so the Appalachian Highlands Care Network was set up in order to help patients and our community members that may have more need navigate that. So that's staffed by community health workers and just a whole supportive team of folks to help those that are in a situation where they need help. So those are your neighbors. So if you want more information on the Appalachian Highlands Care Network, we can get that to you. Our team also runs on the clinical side, and some of you may know Casey Carringer, but Casey is our Director of Clinical Efforts, and under that falls the Appalachian Highlands Care Network, but also our Community Health Mobile Program. We just, of course, the mobile mammography unit's been up and running for a while, but just cut the ribbon on a new mobile women's health clinic that will be up and running and hitting the road soon. And so that's going to be an excellent way for us to serve more rural communities. And so I think that program is going to just continue to grow. We have our CHI sites, which stands for Community Health Improvement Fund. And that's one that I'm going to go, that falls under our team's direct domain. So I'm going to go into a little bit more detail about that because myself and Emily know a little bit more about that than the rest of these things. So I'm going to give a little more deep dive into that shortly. We also have a faith community nursing program that falls under the Department of Population Health, where we have nurses that are stationed and work with our hospital in conjunction with churches and parishes across the region to help strengthen that connection between the faith community and health. We know a lot of times that's a wonderful in for folks. There's a lot of trust built there, and it gives us an opportunity to connect with members of those organizations from the inside and really kind of help us to establish some care and community there. We have our peer help program, which is a peer-to-peer addiction, substance use, I apologize, a peer-to-peer substance use program where we employ, and that program's really neat because it really goes from helping people that are potentially already incarcerated and really helping them, because we know that post-incarceration, it's really, really difficult to, find work. And I know, a lot of these folks on the call and Bristol's Promise does a lot of great work around workforce development in that same realm. So they understand that. But, a lot of times what our peer help people will do, and our community health workers and navigators there will go in and connect with people and ensure that they have, all of the things that they're going to need before they even leave, right? And then they're set up with a support system which will help them navigate the world of substance use, which I knew none of us are strangers to in the region. Lastly, we have our STRONG programs, not to be confused with the capital STRONG programs, but Strong Pregnancies, Strong Starts, and Strong Cessation are all programs that we have aligned to work with the goals of the Strong Accountable Care community. So Strong Pregnancies and Strong Starts really focuses in on prenatal care and post-care and early intervention after that. And then the Strong Cessation focuses on tobacco use. So that kind of covers our internal programs. And then, of course, I think what is probably the most key part is our partners. So since I've been onboarded with Ballad for a couple of years now, I've seen just an enormous amount of collaboration between our internal departments. So we work really closely with, and you guys have to think about this, we're a system of 12,000 people and multiple departments. So it's not like I can just go next door and talk to, Cindy Lou Who about how we could work together. It becomes very complicated. And you can imagine that that's been even more complicated in the midst of a pandemic. So our team specifically and working with other teams have worked really hard to build internal relationships. So, we've been working really closely with Niswonger Children's Hospital for a while, but, our organizational and development team, our clinical folks. So we're really working to strengthen those departments to help achieve goals. We consider every single one of our community health improvement sites a partner. There's no way, to me, this is like the gold star. There's zero chance that we can meet population health goals without community health improvement partners. We also count on some technological partners. Epic, that's our system that we integrate health systems information into that really kind of helps providers not have to, patients won't have to retell stories. All those information and notes are centrally located in one place so that work becomes a little more streamlined for our clinical folks. And that eases, I think, some of the burden of the patient to have to go through and retell things. So that's another big integration piece for us right now. And then, lastly, and I think this is along with those CHI sites, our relationship with the Strong Accountable Care community is absolutely key. So being sort of I think a strong partner for them is one of the ways we know we're going to accomplish this work. And so we'll flow through that. And I'd like to introduce at the end, I think we've got some folks from Strong on the team. So when we get to the end of the call, I'll allow them to, not allow them, I'll ask them to speak with us, and that way anybody who isn't familiar with that work can follow up. So what are our plans? Right now, in terms of our strategic plan, we are really working on data. I mean, that's our big, because we have to have data to be able to measure things. And so when we get into the metrics, I'll give a little more background there, but some of the data projects that we're working on right now, something called Strong Links. Again, that's one of the things that we're trying to align along with the goals of the Strong Accountable Care community. And that's a longitudinal study that's going to follow folks from like our mothers, children through birth to 18, and allow us a data set that will really help us make some measurements. You also have a project called Years of Preventative Life Loss. That's that YPLL, and another called MPINK. MPINK is from a CDC study that really measures around mothers' prenatal care and breastfeeding. So those are internally 3 of the data projects we're working on. And we're so lucky to have Paige McCart, who was just appointed just this past week, our director for data. And so we're getting ready to have Paige leading the helm there and hiring some more folks to help us continue to dig into data. So that's huge for us and something that's also really exciting. In that same vein of expansion, the other big focus for us right now strategically is social care integration. And so we're working closely, you heard me mention Epic before, but we also have the integration of Epic to allow us access to things like Unite Us, which is that platform where we can offer wraparound care to folks. And then integration of Ballad strong programs, like, right there on the point in Epic, we can know whether or not perhaps, we can make a referral to strong pregnancy, strong start, strong cessation. So that integration of social care is huge. And I think where we're going to be for a while, but certainly where we're digging in now. And then just across the board, working to deepen what's been started. I think back when you merged, 4 years is really a blink of an eye. And when you layer on the pandemic on top of that, I feel really proud to be a part of this population health team who has just done phenomenal work in the midst of so much. So, okay, next slide, please. Okay, so I'm going to give you a little bit, and you can go ahead and skip this one. I'm going to give you a little bit more detail into our community health improvement sites, but I want to give you a little background information into why this is so important. So what we've learned in the past several years is that, typically we used to think of wellness and we think of, healthcare and going to doctor's visits, such and such. But what we know now, what actually makes us healthy is our behaviors, the food we eat, whether or not we have housing, do our kids have childcare, what are our stress levels like? That really is the bulk of our wellness, and then of course we have things like genetics and environment, but that access to care piece is a lot smaller than people think. But, a lot of us don't really focus on wellness until we're sick, until we're ill. But if we back up and try to start shifting some behaviors, that's what really is going to shift the health of our population. So compared to what we spend, which is 88% gets spent on medical services. So you can see, and only 4% gets spent on healthy behaviors. So you can see that really needs to get flipped. We need to be spending 88 as a region, we need to be spending 88% on healthy behaviors, and then the 4% on medical services. So that flip is going to take some time and some combined effort, but I feel strongly that, we're the community to get it done. So next. Okay, and I feel like everybody, I'm pretty familiar with most folks on this call, so I'll go over the social determinants of health piece pretty quickly. But all that to say is that when we're talking about those healthy behaviors and the environment pieces, we know that there are all kinds of obstacles and challenges that come up for our communities. Economic stability, that environment. Not just do you have a house, but are you able to walk from your house to a playground for your kids? Education. What is the quality of education and school readiness in the region? Food. Not just do we have food, but do we have the kinds of food that make us healthy, right? And then there's this piece around the community safety and social context, everything from racism, that is a trauma to the community that has to be addressed, all the way up into, are we wrapping around those folks? Is there enough social integration that we are able to wrap support around our folks that need it the most? And lastly, there's the healthcare system, of course, which is us. And is there enough accessibility, and what is the quality of care within the system? And so, of course, all of those are the things that go right into our overall health and well-being versus just needing to be sick. So here's what I want you to really take from this is that health happens in the community. It doesn't happen at the doctor's office. I mean, that's how we can get well, right? But when we're talking about shifting a dynamic, we have to count on our community to help us with that work. This is a joint effort that's going to take some time. So we all really are stakeholders in the effort to make our community healthier. All right, so going back to that COPA CA piece, we are designated with a certain set of metrics. That's in pink, which is that data set I was talking about from the Center of Disease Control around prenatal and breastfeeding. We've got breastfeeding initiation, mothers who smoke, neonatal abstinence syndrome. And I would even kind of approach that as also not just NAS, but even substance exposed children, because sometimes, you have to have a diagnosis for NAS that looks a little bit different. So I would even expand that into substance exposed. as our target. Kindergarten readiness, which should really say school readiness. That's my friend Heather, I think she's in here, has taught me a lot about best language, and I need to make this change to this graphic. Youth tobacco use, teen births, third grade reading, drug deaths, eighth grade math, overweight and obese children, and prenatal care. So you can see that's like a wide range of a lot of things that is difficult to just say. It's like I joke with my team sometimes. I'm like, let's hop on a call and end childhood hunger, because sometimes that's what it feels like, because it feels a little bit overwhelming. But when we realize what is the best pathway to get there, it becomes a little less burdensome, which is collective impact. So these are, if you'll go next, so what the community health improvement sites were intended for, and so this is one of the programs that falls under our realm, is that we really wanted to align our efforts and investments, not on creating our own internal programs to solve these problems, because again, healthcare system can't fix the health of the community. That is best laid in the hands of the community and the folks that are already doing it. So our Community Health Improvement Fund, what we're looking for in those are organizations that are using best and promising practices already to help move the needle on any of those metrics or social determinants of health, which I just mentioned. So for example, I'm going to pick on Bristol's Promise because they were kind enough to invite us today. We align with Bristol's Promise on a few different fronts, but for example, we really are looking to Bristol's Promise to help us sort of regionalize, be this sort of, central parent, help us really rein in like parenting classes. Let's say that, like, we know that they have a ton of expertise there. So we want to put our funds places where we know people are doing it and doing it with the best practice. And not to say that we don't want to align with other organizations who are doing that, but the goal would be to have them work with all those other organizations so that work becomes a lot more collaborative. So we fund, and I should have included a little list of our sites here. Emily, do you want to give a little bit of context, like another example or two of some sites that we're funding right now?
Sure. We fund collaborative sites as well. So like some after school programs, we fund multiple boys and girls clubs under one umbrella. And 3 different YMCAs under one umbrella, which is really cool to help support collective impact work through funding, but also through like monthly meetings with them to help align their programming and their best practices within their after school programs. We also fund healthy families with out of Big Stone Gap and try to align our work with them. So there's a variety of different efforts that we're funding and supporting.
Yeah, and so like Emily said, we really hope to, while it's not a requirement, we're really looking for folks with the mindset of collective impact already. So it's definitely a helpful start when folks are already geared towards that collective impact mindset. If you look here, you can kind of see a breakdown of our investments over the past few years across the states and how many organizations we've funded. And then this is our total investment to date. And some of these, that little asterisk down there, which is tiny to read, but a lot of these organizations here, like for example, in Virginia, some of these are based in Tennessee, but serve both sides of the state. So just wanted to make that, it looks like there may be fewer in Virginia, but most of the time we have equal people funding on both sides of the state, so, or organizations working equally on both sides of the state. So this is kind of a breakdown of how this program has grown in just the past 3 years. So you can see year one, I think we were hitting right at 10,000 in terms of services rendered. So these are services in total, and some of these clients may be duplicated, but year one we moved from 10,000, and then into year two I think we're at 67.5, if I'm saying that number. Emily can probably say it off the top of her head better than I can. And this year 3 is what is our projected serve. So we're not anywhere near calculating the data for year 3, but you can kind of see where we're studying this growth. I think a lot of that is via collective impact work. And so that last number, that year 3, I will say that is projected based on our CHI sites for this fiscal year. You can go ahead, Melissa. All right. And I want to say before we move on to where we're heading, one of the things that we've done internally is, and I think if we have other CHI sites on the line, they can attest to this, but, it was really difficult in terms of when you're talking about collective impact work, we might have, and I know, oh my gosh, my brain just, Miranda. Miranda's on here too, who used to be on our team. You know, there were several of us, and, you know, it was like, okay, what's the best approach? And a lot of it was kind of trial and error. Do we work regionally? Do we work by county? Do we work by state? Do we work as a whole? And then after a couple of years, you know, it made more sense to say, for in terms of what we were doing, to streamline that work. And so we've moved Emily Wells, who's on the call, over to be our community health improvement specialist. So she is able to see from sort of, and I don't use this, I know this word has an omniscient view, so to speak. So, but she's able to see everything that's going on across all of our sites, which really from a collective impact standpoint helps us piece together work a lot more quickly rather than having, you know, 4 or 5 of us doing it and things getting, so she's done a phenomenal job standardizing processes. Heather used to be on our team as well. And so we've just done a lot of shifting and changing on how we operate these community health improvement sites. And so I just want to take a second to shout out Emily, because again, if I could clone her, I would have 16 of her. So she's just done a fantastic job. So I want to talk a little bit about where we're heading next. All right, so this is where we think you all come in. And when I say you all, I mean folks that may already be community health improvement partners, folks that aren't. We are really leaning into the community to help us build a true community health improvement system. You know, Ballad doesn't want to be known. And if you start looking into the face of healthcare and how things are changing, that old sort of standard of what a hospital system looks like is changing rapidly. You know, we've got clinics and pharmacies now, and, you know, you can kind of get a sense in probably your own communities how things are shifting in the world of healthcare. But so that's kind of where we're trying to bend the rod, so to speak, in order to become not a place of illness, but a place of wellness, and move into that community health improvement system versus a hospital. Next. All right, so how are we going to do that? That can be a little bit difficult, but I think what we're hoping for is that everybody can start working from this theory of collective impact. And I know, again, I always refer to Bristol's Promise as the OG of collective impact, because they've been doing such a phenomenal job. And what a collective impact model looks like is having that one common agenda for change, being able to share our data and our measurements, mutually reinforcing activities. So this is where we're all like, hey, let's row our boats in the same direction. If we're not in the same boat, let's all, like, you know, line up and row it in the same direction. You know, keeping open and continuous communication, and then having backbone or supporting organizations in order to do that work. All right, so this is the part where I just kind of want to get into what we need from folks right now. And so ultimately, we need care. And when I'm talking about care, I'm saying that we need on the organizational level and on the self level, we need folks to take care of themselves. You know, I think a lot of the people, especially who can work in youth, work with youth, or work in anything, you know, remotely related to social care, can get burned out very easily and very quickly, because this work is hard. I know you guys probably know that already, but I want to affirm that this work is difficult and it's long, and sometimes there isn't immediate payoff or results. And so I want to make sure that everybody is taking care of themselves, and then taking care of your organizations and your institutions, just making sure you're using, you know, best practices, and hoping to see more diversity, equity, and inclusion pop up so that everyone is cared for in the right ways. And then certainly taking care of other organizations. And I like to think of this as like, you know, we all have personal egos, and I think we all have organizational egos, but this is really the kind of work that we're talking about here. Collective impact requires who here has an ego? I think I have 2 sometimes. But anyway, it's letting go of ego in order to be more collaborative. And so I like to think of it as kind of a root system. So for example, our service area is really large. And so for most of us, we're probably located in a more urban area. And those are like, you know, the main Tri-Cities. You've got Bristol, Kingsport, and Johnson City, right? Those are considered more urban areas. But then you think about, you know, if our root system goes all over the region, we can't just water the Tri-Cities, right? We have to water those far-reaching counties in East Tennessee and Southwest Virginia. So it's leaning out in order to help water our neighboring counties. And so working to care for one another and collaborating when you can. All right, the next piece is intentionality. And so I think that just means is that for me, it's like we can sometimes get so caught up in the forest or in the trees that we can't see the forest anymore. So it's continually going back to your mission, vision, and values, and sort of checking to say, like, am I still operating in alignment? Are we still operating organizationally in alignment with what we're doing? And that may mean, in your strategic plan, and that could even mean your day planner. Sometimes I'm like, I'm doing a lot of things that aren't really in line with what I probably should be doing this week. Let me shift my calendar. And so sometimes we need that because we get so caught up in that, probably a lack of self-care by saying yes to everything that we can lose our intentionality. So it's kind of being really protective and careful with your time and your intention. All right, so next is relationship building. And again, mentioned on this before, and this will kind of go hand in hand with collaboration, but I say this a lot and I'm so grateful. Melissa mentioned that we've been working together for a couple of years now and getting to know each other, and we really have become friends, right? Like we have a friendly relationship, but it's because even though we don't work for the same organization, we treat each other like colleagues, right? And so that's kind of the direction that I'm hoping to see all of our organizations start to reach out to, dropping the organizational ego and working to build relationships, right? Because there is the reality that sometimes we have to compete for funds, or we have to compete for, I guess, publicity in a lot of ways. And that can, I think, really put a thorn in the side of collective impact work. And so it really is working to build relationships and letting go of all that ego in order to collaborate. And then I think that's where we start to reach and water, if you're looking at it like a root system with enough work and effort and intention put in, then you can start to really build out that root system so that we're watering our entire region. And lastly, we need good storytelling. We know that there have been repeated narratives about what it means to live, not just in the South, but specifically in Appalachia, what it means to be Appalachian, what it means to come from our region. And we need to start telling the story we want repeated. And I feel like we are working towards becoming, again, for me and from the angle of our work, it's becoming that community health improvement system. We have an opportunity to build out something that says, hey, we did it. We didn't need anybody from the outside to come in and do it, right? We're already doing it. And so I think that we need good storytelling in the realm of what we're perpetuating in the region, and good storytelling from the lens of each organization, and a lift in positivity. We've all been kind of dredging through the past few years, and I think we're all ready for a different narrative. So I think that's exciting. Next, I have another slide that may be the end of it there, and then yay, that's it. So one of the ways I'm just going to go, and you can, Melissa, if you just want to stop sharing screen, I can just chat for a second. One of the main partners that we work with is the Strong Accountable Care community. And so that is, and while we value everyone who's doing that work, in order to get it done, and we know that we all have to row the boat in the same in the same direction, we have to count on sort of a unifying body to help us get that work done. And so for those of you who don't know about the Strong Accountable community, I'd like to give Mark, or if someone from their team is online, just to give a quick introduction to what they do. Just like an elevator pitch, and then maybe it'd be great if we could have them back another time, because I know they've been working hard on reinventing a lot of the work of the Strong ACC.
Just to jump in, and Mark can introduce his staff too, but we've had Mark's been on this program at least once, maybe twice.
Oh,
but
great. Oh, good.
Definitely recognize the kind of Strong ACC as a huge participant. So
awesome. Well, that said, that for me, it's like we look at the Strong ACC as like kind of the banks of which the work is going to flow. And so I'll give Mark just a quick chance to introduce himself in case someone doesn't know Mark, and then they can reach out and connect.
Good afternoon, everyone. Thank you, Rachel. Thank you for that those remarks. And I'm Mark Cruz, the director of the Strong Accountable Care Community, and also on the call today is Heather Logan from our team, one of our community engagement specialists, and Brittany Bowles is also normally with us, but she is out sick today. So, but we appreciate the mention today. And Margaret, thank you for being a member of our leadership council and a stalwart advocate for the work of the Strong ACC. Perhaps in light of the fact that we have updated our strategic agenda recently, it might be timely to do another update presentation sometime in the new year. So keep that in mind, and we'd be happy to do that. I'll just say, you mentioned, Rachel, about changing the narrative, and one of the things that we've adopted in recent weeks within the Strong ACC is a motto: "Together we are strong," and I think that conveys it well. What we want the narrative to be for ourselves and for our region. Not that we're better than anybody else or any other region, but that together we are strong and we are resilient, and we have what it takes to succeed and flourish. So lots more to share about that, and hopefully sometime in the early half of part of 2023 we can do another update and share our new vision and mission and goals, and continue the good dialogue that takes place within this group all the time.
Thanks, Mark. It's really a pleasure to work with you and the Strong Accountable Care community. Does anybody have any questions for me regarding the population health presentation?
Questions, comments, y'all can put them in the chat or just speak up or raise your hand. We're kind of able to see everybody.
I do have a question, actually, and I don't know that you'll have an answer for it, but it just struck me as you were going through your presentation, and thank you for that. So you were talking about, when you were talking about how we stay healthy, this was one of the earlier slides where we have it backwards, much like how we take care of children. So what, if any, advocacy are you all doing for those social determinants of health, especially access to health care? And how can we support that in what you're doing so that we're all singing from the same song sheet on our advocacy levels too?
Yeah, that's a great question. And I think maybe, Melissa, it'd be a good opportunity to connect with the Appalachian Highlands Care Network. So that's really kind of the piece which we're trying to route that advocacy, especially when it comes to access to care. So we want to grow that. We know that, and it's difficult because when you're talking about the clinical side, and I don't want to overspeak where I don't have as much knowledge, but when we're talking about the clinical side, we also have to account for things like, Virginia has expanded access to Medicare or Medicaid where Tennessee has not. So we're kind of operating on two different sides of the state. But then again, even though Virginia has expanded access, there's less opportunities for specialty care in Southwest Virginia as there is in Tennessee. So we're always kind of doing this right now, and it is a constant balance. But that's really where the work of the AHCN plays in. And so have you met Bethany Patrick yet? Have you had an opportunity to chat with Bethany? I'd really like to connect you guys with Casey Kieringer and Bethany Patrick so that you can learn a little bit more about the clinical side of that integration. But in terms of advocacy, that's a lot of that work is moving through Appalachian Highlands Care Network. But, on a personal and organizational level, I'm always for make sure that, you're aligning your votes are like dollars. So wherever you think that is going to help move the needle, certainly keep working with your state legislations. And I know that's something that Ballad is working towards, and then organizations like the Strong ACC. I'm hoping that, again, advocacy and policy will become a huge piece of, I know that's going to be a huge piece of what they do in the future too. So I think you can stay tuned to Mark for more of that. But in terms of that access to care, the Appalachian Highlands Care Network is really the avenue we're using to spread that work.
Thank you. And we're not, at Appalachian Promise Lines, we're not healthcare experts, nor do we want to be. That's not, but we just know how important this is to the folks that we serve. And we want to be on the same page
Yeah.
across the region.
And to know that that's a resource, if you're, for example, it could be that you have, you meet a mom who you find out doesn't have, has a complicated health history and needs some more specialty care, but doesn't, doesn't have insurance. And then, now that you can connect her with the Appalachian Highlands Care Network. And then, there's care navigators, not just to help her get the access to care, but to help her navigate through the system. So that's where we can really pair folks up with community health workers or navigators to help them through, not just get the appointment, but to help see that through.
Other comments, questions? I'll add to that just a little bit to say that, and when we had the merger, it was a lot of controversy about the merger, and continues to be a lot of folks who have issues and complain, etc. And I want to just say first off that I'm a huge advocate for our population health. I think the work that's going on and the hope for the future and what we can accomplish and already working on is beyond, I think, some of our wildest dreams. So just hugely excited about that. But what I do try to recognize and share with folks that we may have a lot of problems with our clinical healthcare system, but it's not necessarily Ballad. It is our broken healthcare system in our country that has just tons of issues and systemic issues, and that's where the advocacy comes in. It's not just us that are struggling; it is across our nation, and some states more than others that haven't chosen to make decisions that would help some of the most vulnerable folks and the folks that fall through the cracks. So anyway, so I just encourage y'all to learn what you can about it and to know that it's a big picture with a lot of issues. But for me, the population health piece, along with ACC, strong ACC being part of that, I think it's just phenomenal for the excitement for what's happening and what we can all do together, right? Stronger together. So, yeah.
That's a great point. And I think, mud rolls downhill. And I think that I agree with you. I think on a national level, the healthcare system's been broken for a long time, right? And, we'll just go ahead and affirm that, yeah, the merger was problematic for me. I'm from a very rural county in Southwest Virginia. So it was very, very problematic, I think, for those of us who are worried about access to care for our family and friends in more rural areas. So I 100% understand the hesitancy. And at the same time, I don't see, Ballad is the formed entity, right? So we have a couple choices. We can work together to create a community health improvement system, or we can just, I don't want to say, it's just like we can just, we can use that energy a couple of different ways. And that's part of why I wanted to work for the system, right, is to be able to make a big switch from arts to healthcare. But I believe those things are closely intertwined. I know the Brussels Promise team will agree with me there, but I feel like we have to tell that different story. And it's not just telling the story, we have to change the narrative. So stories can be true or not true, right? And so I think that there's a lot of narratives that people assume about Ballad that, now that I work from inside the system, really aren't true. And there are stories that get perpetuated that I think keep the system from being the real kind of community health improvement system that it needs to be. And so I really look forward to just continuing to build relationships. And, that does mean, though, on the systems level, that there has to be accountability, right? And that's a big piece of the puzzle. And I am one very tiny dot on a puzzle piece. So, and I feel strongly that power belongs to people from within a region. And so if we determine that we're going to build a community health improvement system, then we will.
Great. Thank you.
Yeah.
Other comments, questions? Because I have another two. So one of them, Rachel, was so this is a 10-year investment. So, and at the beginning, that looks like a long time as we're in it and know what it takes. And just like for y'all, it took a couple of years to kind of set your pace and figure things out. And that goes for all the other work that's being done, contributing. So what are we starting to anticipate what happens to the end of those 10 years? I mean, hopefully by then we're going to be seeing some great data. And also most of us on here are part of nonprofits that we are all the time concerned about funding and not enough funding and where are we going to get our next funding, et cetera. So is there planning that goes beyond the 10 years, or do you know what might be coming?
Yes, I totally get that. And it's hard because it's like 10 years really feels like a flash in the pan when you work for a nonprofit because you're having to think so far down the line to that. Do I specifically know what the plan is after 10 years? No, but here's what I do know. That's part of why we have selected organizations who have best and promising practices, who already have a level of sustainability built under them. That's not to say that there won't be continued funding. I do not, I wish I could answer your question point blank. I don't have the answer to that. And what I do know is that we really work to select organizations and will continue to select organizations that can work collaboratively, that can work in a way that, or already have sound, promising practices set up and funding sources that are sustainable beyond 10 years. I think it would be errant for any organization to think that we would be the sole source of funding or streamed funding. And so while we can be an aid in helping to build those metrics, we can't be the only source of funding. So I don't know exactly what's going to happen in the 10 years. That's for, Tony Keck and Todd had joined you earlier. Those are the brains that really have to start thinking beyond the 10 years. And so I do know that they're well aware, though, and they're well aware of the community perception about what's going to happen when 10 years is up, right? So I know that they're really working hard to set up a system that is sustainable. I wish I had more detail to give you than that.
But okay. We'll get back to folks in another year or so and ask this.
Oh, I'm sure. Yeah, I have no doubt that we'll have to keep it rolling. I think that's a great thing. I appreciate when the community is invested enough to hold the system accountable. That's the way it should be.
So the other area that I just wanted to throw out or whatever for recognizing, and then if anybody is really trying to figure out or has a plan, but with the work that's being done both by Ballad and Strong ACC and the TANF grant that Northeast Tennessee got, and all the different exciting things, we need a lot of the same kind of workers. And as you've already talked about, this is hard work. There's lots of rewards, but there's also lots of frustration and sadness and not being able to see the results immediately, etc. So we need to be sure that we have folks who are moving into these fields and who are choosing to do this work. So what do you know, do we have more of a plan, or we recognize and we need to have more of a plan, how to really nurture and encourage folks, and that would be a lot of our younger folks, to go into these fields and help us meet the needs.
Yeah, I think that's an excellent question. I'll speak first from the Ballad perspective of like workforce pipeline in terms of the healthcare industry. And I know that Ballad is working really strongly with, college and universities across the region to really first and foremost strengthen, because we have to have that nursing pipeline first and foremost in order to take care of people who are ill until we can cross over to that wellness side. Until we can flip that chart model that I showed you, we have to ensure that there's plenty of people to take care. Now, the second piece of that is, when I talked about our partnership with folks like Strong Accountable Care Community, what we're trying to do is align, because as a health system, we can recognize that workforce development is a part of overall wellness, but we can't also take the charge on leading it. So what we can do is work to align with folks who are. And so that's part of one of the things that we're working closely with the strong accountable care community. So I feel like in terms of that particular work, that's really where we're leaning on our community partners. And while we fully plan to support in terms of our own internal initiatives, those are really limited to the healthcare sector. However, we are strongly supporting and working closely with, our academics and research team is working really closely on workforce development. I know that there, and Emily might be able to speak a little bit more closely to this, and I'm sorry to put you on the spot, Emily, but I know that, for example, we've taken an interest, not just in healthcare specifically, but, in STEAM, STEAM activities and trying to set up and I encourage, I think, students regionally to get involved. And then again, that's where we're funneling our support into folks like the Strong Accountable Care community and members within that organization who that is their sole focus and work.
Emily, do you want to add anything?
I feel like Rachel covered it pretty well, but I will just mention that another kind of department within Ballad that I think could be really useful to get on one of these calls is the Department of Academics and Research, because they are really focusing in on that healthcare workforce pipeline, but they are also really focusing in on CTE programming and supporting a variety of different initiatives. For example, StreamWorks is funded through some academics and research funding, and they are an awesome organization that I know is a member of the Strong ACC as well, and they provide robotics and competitions and different STEAM opportunities, all of the different acronyms. So that is another department within Ballad Health, and that was also on that breakdown of different funding. They do a lot of work within healthcare pipeline and within the STEM work.
Right. I guess my comment on that is we need human services. I mean, I'm all for STEAM and STREAM, and I think those are critical for our workforce development, but also we need to be paying attention to human services. So
Heather Logan did put in the chat that Bright Start Northeast Tennessee, their plan is advocating for higher wages for the helping professions.
Yeah, which is a huge piece of it. Huge.
Oh, it's enormous. I mean, I know probably everybody on this call that likely doesn't have a mathematics or a technical degree, right? Like we probably went into helping professions. And so we did that for a reason. And I agree with you completely, Margaret. We have to have, you have to have that. And I call it more essential skills than soft skills. But if you don't have folks that know how to communicate and how to take care of themselves and how to take care of other folks, like we're going to have an enormous gap.
Right. So, okay, anybody else have comments or questions? And what we usually do is take a few minutes to share information. Anybody else have anything? And Rachel, do you want to say any closing comments, or you?
I want to say thank you to everybody for having me today, and I just want to encourage everybody to hang in there through the rest of the holiday season. Rest where you can. Get ready to re-energize. I guess we'll all be moving into, if you're on a fiscal year, to the third quarter, so you're kind of halfway through things. So I hope everybody has a gorgeous holiday with their families and friends and has a chance to reset and re-energize to keep the work in our hands and our hearts and our heads as we move into a nearly new year, and just encourage everybody to keep plugging into all things collective impact.
That's good. Thank you. And thanks so much for joining us.
Yeah.
All right. Folks who are here, does anybody have updates? And already thank you, Marissa, for putting your information in. If y'all want to stick your information, we will send out the recording, and we'll also send out the chat. Also want to always remind that between Melissa and myself, we have contact information for just about everybody who shows up on these meetings. So if you saw somebody you want to connect with, you can always reach out to us, and we can work on connecting. So and Kay Ward, who's with Bristol, Tennessee City Schools and Reading Buddies, is jumping off. as well as Amanda. So anybody want to share anything? And Melissa's going to share in a second upcoming dates. And also, Melissa, if you took time to talk about, we've got a couple of new staff folks you could mention as well. So anybody have comments?
Me.
Lynn, Pinnell, go for it.
Of course. Thank you all very much for sharing today. I appreciate that. I just wanted to say we're moving forward with the Envision Center and having more activity happening all the time, and happy for that. I do have an opening. We were talking about workforce and that I have an opening for an admin person here at the Envision Center. And I just love to have a pool of people to choose from. We've put it out there, and the pool has been very, 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 very short. So finding people willing to work right now has been very difficult. So if any of you know any people,
Right.
send them my way.
So, and Lynn, just say what the Envision Center is real briefly.
Yeah, the Envision Center is a HUD initiative developed by Ben Carson in the previous administration. So they're not reappointing new Envision Centers, but the ones that are established are still going. And it's designed to be in the community what the community needs. And so ours is a point of contact for both sides of the line. We serve Virginia and Tennessee. And help people in a referral process. If they're not connected to case management in an already service-related relationship, then we want to help them. That was one deficit that we did see in our community and have seen for a long time, that people didn't have any place to go or anywhere to call. And so we offer services here with the staff that we have, but we also provide space and activity for partners to have activities housed here at the Envision Center. So we have GED classes. There's a lady here does financial planning. She's here first Thursday of every month, and we do a lot of different things. We have your peer help folks that are here usually here on Thursdays. He's not here today. He had car trouble, but normally they're here. We have a great relationship with them, and we have I can't even remember now.
That's
Several
okay.
things. And Big Brothers Big Sisters is coming, so they're going to be housed here at the Envision Center in the new year. So we have a lot going on and a lot of space. We'll have three, once we're finalized and we have purchased all of our owls, we will have 3 different size meeting rooms available for community meetings. If anybody needs those, they can be scheduled. So we'll be putting that out there. We're going to have a grand opening, hoping the middle to end of January. Great. So we'll let you know, and you'll all be invited to that. So it's fun.
Okay. Thank you.
Mm-hmm.
Anybody else adding things?
Rachel had her hand up. I don't know if that was for anything, but
I was clapping.
Oh, okay, good. Thank you.
Yeah.
Good. Very good.
All right. Melissa, do you want to talk for a minute and give us some dates?
I do. And Lynn, if you will send the job description over to me, I'll get it out for you, because we, and I introduced Susan earlier, but we have 2 new staff members, 3 total actually. So we have a community coordinations manager, which is Erica Ashford, and she's on site today. We have Susan Turner, who's the PACES coordinator. And then we also have Lily Royston, who is our parenting program manager. So they are all hitting the ground running, and we could not be happier. We've got some really good folks. So we are fully staffed, y'all, which is a celebration in and of itself. But I do want to announce that the next the next Southwest Virginia Trauma Informed Care Network meeting is next Wednesday, December 7th at noon. And you can find that information on our community calendar at bristolspromise.org. If you want to get involved in this work, these meetings are the way to do it. It's a way to learn about resilience, but also what's going on in our community and connection. The next Northeast Tennessee Trauma Informed Care meeting is February 23rd. But we're going to have several coordinating meetings prior to that. So we had some listening sessions a couple of months ago in association with the Tennessee Commission on Children and Youth. We're going to follow up on those throughout the 8 counties of Northeast Tennessee. So if you're interested, I've put my contact information in the chat. Melissa at bristolspromise.org. Reach out to me, say, hey, can I get on the mailing list? And we will make sure that whether you're in Southwest Virginia, Northeast Tennessee, and you can come to either of those meetings because we try to coordinate really closely.
Okay, thank you very much. And I'll just note the next Youth Networking Alliance meeting is scheduled for January 26th. We don't have a program yet, but I think in this meeting we heard of 2 potential programs that we may follow up with. Mark, we may get in touch with you for that one or the March one, and then also doing more with Appalachian Highlands and advocacy. And we have advocacy also that Tennessee Commission on Children and Youth, and they have connections with Virginia folks as well. So we've got some good advocacy along those lines that we may follow up with some programmings. The other one that I'll mention, and Melissa can correct me if they're not meeting, but our Parenting Educators Network meets on the second or third Thursdays. It meets virtually. That's Samantha Gray, who works with that. And now Lily Royston, who's helping as well. So we're trying to, the goal of that is to get everybody who is doing parenting education in our region to be listed as a resource. So it's one place to find it. And then also to attend and be able to network and follow what we're doing and be sure the gaps are acknowledged, and connect with all the other services, particularly Strong Pregnancies, Strong Starts, to get the word out for what's available for folks.
And that network meeting, the Parenting Network, Educators Network meeting, is December 15th at noon, and it is virtual. It's also on our calendar.
Yeah, thank you. So, okay, anybody have any other last minute additions? If not, we appreciate everybo's attending and look forward to seeing folks again. And Rachel, we thank you. Yeah, I guess the words are everything Rachel said, plus holidays can be really stressful. So you go from your work stress to your home holiday stress, and then we need a vacation after that. So anyway, the biggest thing, try to stay healthy. So see what you can do to do the things that can help you stay healthy through the holidays. So anyway, thank you very much, everybody, for attending, and we'll look forward to seeing you soon, one place or another. Take care. Bye-bye.
Thanks, everybody. Bye.